So sometimes or not sometimes, a lot of times we have people that come in the office with hip pain. And one of the types of hip pain that you can get is when you get pain on the outside of the hip or the lateral side of your leg, almost like the upper part of your leg, right below the belt, the start of the, like I said, the top of the leg. So what that many times will be is something that's over here, which is called the bursa. So you have a bursa, which is a sac that's over that bone to help things like flow over the bone and not get caught on it. But those bursa can get inflamed. And so you may have something called hip bursitis, which is an inflammation of that bursa, and it can be very painful, especially to the touch. So laying on your side, like in bed or on the couch or something like that, and you get a lot of pain on the pressure side, that is many times bursitis. So if you can find that and you know that's there, then you can do something to help fix it. So sometimes just icing can be helpful. Also too, stretching what's called the IT band. The IT band is a band that basically starts at the greater trochanter and goes down to the lateral knee. So that IT band gets very, very tight, and what it does is it puts a lot of pressure in that bursa area. And so if you can open up that IT band, whether it do foam rolling or some sort of mobility, you can use a vibracussor down the IT band, but you want to get down and you elongate that IT band, because then that will actually take pressure off of that lateral, that bursa of the hip, and help that bursa feel better and decrease the inflammation. Sometimes you may need to get things like, sometimes it's so inflamed, it's so painful, you may need to do injections. Many times what works really, really well in our experience is PRP, platelet-rich plasma will actually inject in and around that area, and it helps to decrease the inflammation. It's a healthy platelet growth factor type of product that comes from your own body, but helps to fight off pain, and it works really, really well for bursitis and that inflammation of that lateral hip out here on the outside of the hip and where that greater trochanter is. So if you have that and you have that pain out there, first work on that IT band, and if you're still noticing a lot of pain, then things like I said, a platelet-rich plasma, we can do more therapies, etc., but it'll help to elongate that lateral side of the leg and help to take pressure off of that bursa.